What's up, guys? My name is Takeyah. I'm an orthodontic assistant, and today I'm going to go over the orthodontic photos that we take initially at the first appointment. I have had braces before in the past, and I am considering getting braces again. So I will be using my own photos in order to explain to you guys how we take the pictures and what exactly the orthodontist is looking for. I do orthodontic and dental videos every Tuesday, and I also do content with my family every Friday. So make sure you're subscribed so you don't miss out. All right, let's go. In orthodontics, we take a series of pictures in order to see how your bite is, to see what teeth are rotated, and to see what type of treatment you will need. So here is my template of all of the orthodontic images that the orthodontic will require the orthodontic assistant to take. The first set of images are called the extraorals. And these extraoral images are just images of the patient's appearance and their profile. The first extraoral image that is taken is just a straight-on shot. Some people call this the front. And in this image, the patient is looking straight and not smiling. So the orthodontist just wants to see exactly how the patient's face looks, just looking straight on ahead. The second extraoral image that is taken is called the smile. And in this image, the patient is smiling. And in this image, the orthodontist is just looking how the patient smiles. The third extraoral that is taken is called the profile picture. And in this image, you want the patient looking sideways and looking straight ahead. And you also do not want the patient smiling in this image. In this image, the orthodontist is going to be looking at the profile, and they're also going to be looking at the nose, the lips, and the chin, and seeing how everything aligns when the patient is just looking straight forward and is relaxed. So all three of those images that I just previously explained are called the extraorals because they are just pictures of the patient's appearance and their profile. The remaining images are called the intraorals. And the intraorals are called intraorals because all of these images will just be images of the patient's teeth. The first intraoral that is taken is called the Maxillary Occlusal. And in this image, we're just looking at the upper teeth. And of course, the upper is referred to as the maxillary. And then in this image, we can see all of the surfaces of the upper. And the surfaces in dentistry and in orthodontics is referenced to as the occlusal. So that's why you'll sometimes see this image titled as maxillary occlusal. And in this image, the orthodontist is looking at the upper, seeing how the upper teeth are aligned, and also looking at the surfaces of the teeth. The second image that is taken is called the 45-degree image. And in this image, you want the patient tilted chin up, and we are looking at the patient's bite and seeing how deep the bite is. So some patients, their bite, they're sitting just upper and lower teeth, neck and neck. Sometimes you have the upper teeth way over. Sometimes you have the upper teeth way back and the lower teeth are way forward. In this image, you can see exactly how deep the bite is and how far the upper teeth are or how far the lower teeth are. The next intraoral is the lower teeth, and you also may see this titled as the mandibular occlusal because the lower teeth are known as the mandibular. And the surfaces of the lower teeth are called the occlusal. So you will see it paired as mandibular occlusal. And in this image, the orthodontist is looking at the lower teeth and seeing how they are aligned and also the surfaces of the lower teeth. The next intraoral is going to be the buccal. And in this image, we are looking at the right buccal. With the right buccal, we are looking to see how the upper right teeth are hitting the lower right teeth and seeing the class of the patient. And when I say class, in orthodontics, we reference certain bites with classes. So you may have a class 1 bite where your upper teeth are like further than the lower teeth. And then you also have different bites that are classified as class 2 or class 3 or maybe even a cross bite. So in taking this right buccal shot, you can see what type of class the patient's bite is. In this image, it's really important that you're getting starting from the cuspids to the second molar so you can see everything. Sometimes it's really hard to get that shot, so we do have cheek retractors that are shaped this way so you can pull all of the cheek back to get that full buccal shot. The next intraoral is called just the front, which is the straight on shot of the teeth. And in this image, the patient's smiling, and this is the patient's true bite. In this image, you can see everything from the second molars to the front and the centrals and the second molars on the other side. In this image, it's really important that you're getting the patient's true bite and making sure that the patient hasn't moved, that the patient's not sitting further than how they truly bite or sitting further back how they truly bite. So I always like to tell my patient, just make sure you put your tongue to the roof of your mouth, like, and then close like that. In doing that, you do get the patient's true bite. The next intraoral is called the left buccal. The left buccal consists of the left side, and in this image, the orthodontist is looking for the bite and how the patient bites on the left side. Again, the orthodontist distinguishes different bites by using classes, and the orthodontist will see what type of class this patient has on the left side. Basically, just what kind of bite they have. As an orthodontic assistant, these are one of the first things we learn before learning anything else. These pictures are kind of self-explanatory once you understand what we're looking for, but sometimes it's hard to remember the order in taking the photos and the order that the orthodontist wants the images. So I did go in the order that my orthodontist typically likes it and how usually majority of the orthodontist likes the images. So usually you'll find that every orthodontist will like the extraorals first and then the intraorals. Knowing the order, you can take the images in that order, or if you want to take the images in a random order, just make sure you remember the order. So when you go to upload the images into the patient's chart, that it is in the order that the orthodontist wants the images. Well, thank you guys so much for watching this video. Go ahead and comment any questions you may have. Like this video, subscribe, and I'll see you guys in the next one.